Welcome, everyone, and thank you for joining our webinar today. We have a fascinating presentation with a lot of content to cover. So without further delay, I would like to introduce our presenter, Jan Kirk-Carney. So Jan is she's at the University of Vermont, where she is the Associate Dean of Public Health and Health Policy. She is also a professor of medicine at the Larner College of Medicine at the University of Vermont. She's director of the Graduate Public Health Programs, and she's a former commissioner of health for the state of Vermont. Her areas of expertise are public health practice, health policy and advocacy, clinical and transitional research, and linking public health and clinical medicine. Jan is also the author of 2 books, the most recent of which is A History of Public Health from Past to Present. And you'll see many of the examples that she presents today are drawn from the book. And with that, I'd like to turn it over to you, Jan.
Thank you very much, and welcome everyone. Today we have some exciting topics to talk about, and we're going to be talking about cholera to COVID-19, vaccines, the environmental awakening, and then healthcare. So let's start from cholera to COVID-19. Cholera was noted in ancient times, and the first outbreaks, the epidemics in Europe and North America, came via the trade routes from India in 1831 and 32 and killed thousands of people. People believe that cholera was caused by miasmas. These are factors transmitted directly from the air, rotting human waste, soil, atmosphere, and climate-related factors. In 1831 in England, the Privy Council quarantined all the Russian ships. This failed miserably, and the cholera continued to spread and killing 32,000 people in England in just over 2 years. And a lot of the art of the time and artists provided a social picture and commentary about this. Let me show you an example. And this is from the National Library of Medicine. And this is a London Board of Health hunting after cases like cholera. And they're saying things like, oh, if I can but find a smell. And another one is saying, the scent lies strong here. Do you see anything? International sanitary conferences became important also at that time. And in the mid-1800s, they were trying to create uniform international quarantine regulations related to cholera. There were 14 all over the world, the first one in 1851. And they tried to create a consensus, and they had trouble with that because of the controversy about how diseases were spread through the air versus contagion either from person to person or from things to people. Some of the topics of debates were the economic and health consequences on maritime commerce, and this is not unlike the tensions between economics and health that we see today. All of these conferences served as a foundation for the later creation of the World Health Organization in 1948. Britain had 4 noted cholera outbreaks, and John Snow published on the mode of communication of cholera or the spread of cholera in 1849. He did a study in 1854 of the epidemic in London's Golden Square, and he began by mapping the residents of all the cholera victims. He also looked at the water pump's location on his map, finding more cholera cases near the Broad Street pump, which is pump A on the map, and I'll show you this in just a second. And then he reported the results of his investigation to the St. James Vestry and really urging them to remove the Broad Street pump handle, which they surprisingly did. So here is a picture of the spot map from his investigation in Golden Square area in London in 1854. And you can see the cluster of spots around pump A on Broad Street. He conducted a study near the peak of the epidemic, and his hypothesis was that drinking water from the Thames River was the cholera infection source. He studied the area served by 2 different water companies, Southwark and Vauxhall, which was one company, and Lambeth was the other. The Southwark and Vauxhall company pulled water from downstream from London, below where the wastewater was entered the river. So Snow's theory was supported if the death rates were higher in the districts served by the Southwark and Vauxhall company. And in addition to these studies and looking at these associations, he also, and this is where the shoe leather epidemiology comes in, he determined if the water source to each residence where cholera deaths had happened and calculated cholera death rates. And his data supported his hypothesis. Sometimes people wonder why he thought that this was not due from the air. A part of this, or one explanation, is that John Snow was an anesthesiologist, so he understood very clearly how vapors or anesthetic vapors affected the body, and he felt that instead that the source was the contaminated water. But what about that Thames River? People knew that it was polluted as early as the 1600s, but nobody knew exactly how to fix it. And the same river was the source of drinking water for the growing population. Imagine the time. Industry was growing, there was economic success, more people were living in the area, and all of the wastewater was going directly into the river that was also the source of the drinking water. If you want to understand some of how things happened or what it was like, one of the best sources of information that I found was reading newspapers of the time and also looking at the art and certainly cartoons of the era. So in this case, there were letters in the Times, there were a series of satirical cartoons in 1858 in Punch magazine that really made fun of the slowness of work to fix this terrible problem. And finally, in 1858, during a hot summer, everyone could smell the stench, including the Parliament. And the Parliament considered leaving its building, but then they realized that they really couldn't do that. That wouldn't look very well. They tried to clean their curtains and hang the drapes, soaking them in lime water, but that didn't take care of the smell. And actually, this was called the Great Stink. This public outrage that all coalesced at this time propelled a new law forward in just 18 days and required the construction of a new infrastructure to manage the waste for the city's growing population. So here's one from 1828 called Monster Soup, depicting the Thames water. And this is one of my favorites. This is a cartoon from 1858. Father Thames introducing his offspring to the fair city of London, and his offspring were named cholera, scrofula, which is tuberculosis of the throat, and diphtheria. So let's fast forward. In 1918, a pandemic of influenza was a global surprise. It devastated the world. There were 50 to 100 million deaths and more than 500 million infected people. Healthy adults aged 20 to 40 years old were severely impacted. And in less than a year, there were 3 waves around the globe. The public health measures of that time included isolating ill patients, using quarantines, canceling large public events, using disinfectants, and emphasizing personal hygiene. Some things that sound very familiar in our recent past. So here is a picture of the emergency hospital at Camp Funston, a U.S. Army training camp in Kansas, where the first outbreak happened. And this is a Red Cross nurse giving advice to prevent influenza. Some of that same advice we use today. Avoid those that cough and sneeze. Don't visit poorly ventilated places. Cover your mouth when you cough and sneeze. Stay home if you're ill. Walk to your work or office. And that time was avoiding public transportation. And in sick rooms, wear a gauze mask. This pandemic showed an unusual pattern, and you can look at the figure. It made a sort of a W shape. More often, things made the pattern of deaths and illness was more like a U that impacted the very young and the very old. And in this case, about 50% of the deaths occurred in young adults. And people are still writing about why this may or may not have occurred. The other thing I would mention at this time, which was a theme throughout my research, was that there was really sparse data about Black Americans during the 1918 pandemic. And in fact, there was the beginning of some very destructive narratives because this was the same time as the eugenics movement across our country. Infectious diseases plummeted. If you look at the death rate for infectious diseases in the United States from 1900 for the next 100 years, you can see there were many areas of progress. Most states had health departments. We learned how to use chlorine in drinking water to eliminate contamination. You can see the peak of the influenza pandemic. And you can see the first use of penicillin in 1940. Actually, penicillin was discovered much earlier in 1928, but it took a while for us to learn how to manufacture that on a scale large enough that it could be widely available for the public. The Salk vaccine was introduced for polio, and then later there was a passage of the Vaccination Assistance Act such that vaccines could be easily available to more people. Things were getting so much better that in the 60s, the U.S. Surgeon General told the United States Congress that it was time to close the book on infectious disease. But then, in 1976, in July, at a convention of the American Legion in Philadelphia, Pennsylvania, there was an explosive outbreak of pneumonia that affected 182 members of the American Legion, and 29 people died. This was a new and fatal respiratory disease, and that prompted a huge public health response. The CDC sent epidemiologists. There was local public health officials, physicians and nurses were involved, and also this became widely public. You can see on the left an X-ray of a patient with Legionnaire's disease. And ordinarily an X-ray shows the very dark as clear lungs. And this shows a white pattern of a very diffuse pneumonia that was very serious and sometimes fatal. And on the right, we have the Bellevue Stratford Hotel, which was the site of the convention. This epidemic was published in 1977 in the New England Journal of Medicine. And when they wrote about it, they said that the American Legion Convention met in Hotel A. And they looked at a statistical analysis of questionnaires from survivors. And they did questionnaires of everyone who was ill. Physicians helped, epidemiologists worked on this. They looked at the environment. And Dr. David Fraser of the CDC said, although the association with the hotel was not proof, it was nonetheless lethal to the Bellevue. Imagine at the time when we thought we had conquered infectious diseases, and now there was an outbreak of very serious pneumonia that killed many people, and all those people stayed at the hotel. You can imagine that people no longer wanted to stay there. It actually took 6 months to determine the bacteria responsible, and Legionella bacteria are known to be comfortable in water cooling towers and all kinds of buildings from business to healthcare. And when they uncovered the bacteria that cause Legionnaire's disease, they were able to also go back and solve some previously unsolved epidemics of pneumonia. 1981. On June 5th, 1981, the CDC's Morbidity and Mortality Weekly Report reported 5 young men treated for pneumocystis carinii pneumonia in 3 different Los Angeles hospitals. This was an unusual type of pneumonia that was nearly always found in people with severely compromised immune systems. To get an accurate picture of things that were happening at the time, going back to some of the original scientific articles in the newspapers of the time, in the LA Times, they wrote that scientists now suspect a virus, such as CMV or cytomegalovirus, which was a virus known to cause immune system depression in humans. CDC termed it AIDS, acquired immune deficiency syndrome, so that they could describe it and develop a case definition so they could begin to track this and understand potential causes. The first AIDS clinic was established in San Francisco, and then organizations in San Francisco began developing home and community-based services. In New York City, the Gay Men's Health Crisis, the first AIDS service provider for community-based services, began its important work. There were intense controversies right from the beginning. From controversies among who discovered it first, and it was finally called HIV in 1986 as the virus causing AIDS. And this discovery provided what was needed to develop a diagnostic test. And it was first used on the blood supply, because what was uncovered, in addition to gay men, was that people receiving blood products, such as people with hemophilia, also developed this disease. Activism and advocacy came from the patients themselves. People with AIDS began to organize to help advocate for faster investigation, progress, services, most importantly, treatments. And this was very slow. Although AIDS was first reported in March 1981 by CDC, the Reagan administration didn't even acknowledge the need for AIDS funding until 2 years later. And finally, 5 years later, the president asked Surgeon General C. Everett Koop to prepare a report on AIDS. And at the time, remember, the public attitudes around gay men were not very comfortable. And Koop advocated for sex education in elementary schools. He also used the word condom publicly. The controversies continued in San Francisco and other large cities during this time. In 1987, the FDA approved the drug AZT, and that was the first drug approved for HIV/AIDS treatment, but the progress was very slow. And it was so slow that the AIDS Coalition to Unleash Power, called ACT UP, first met in 1987 in the basement of a community center in Manhattan, New York. And the several authors wrote that they were spurred by political indifference and medical foot dragging towards the epidemic at that time. Their work was very, very important. And through their sustained advocacy work, they successfully fought for needle exchange funding, AIDS services, AIDS drugs, healthcare, and HIV and AIDS research. And they actually changed the way that research was conducted during this time. Here is one of the pictures from ACT UP New York. Here's a picture of members of ACT UP staging a die-in near the White House in May 1992. They did all kinds of things that not only called attention, but were successful in actually changing the approach to HIV and AIDS. As an example, they stormed the international AIDS conventions and shouted down speakers. People with AIDS marched down center aisles such that the meeting could not go on without people paying attention to what they were saying. They interrupted Wall Street. They created a cemetery on the lawn of the NIH, the National Institutes of Health, and actually asked to speak with Dr. Tony Fauci, who spoke with him. And they explained that the people who were needing treatment were just too ill to participate in conventional clinical trials. And so they had to study it a different way. Dr. Fauci listened, and they did. Some of the public education, and this is from the Surgeon General's office, Understanding AIDS, and some of the campaigns were educational and fact-based, and others were more fear-oriented. The one on the right is from a campaign called Don't Forget Your Rubbers in 1987 for the Vermont Department of Health. And even though this was Vermont, the largest TV station would not air this campaign at that time. The epidemic became a pandemic in the 1990s. Highly active antiretroviral therapy was discovered. In 1999, the World Health Organization reported that HIV/AIDS was a leading cause of death in Africa and the fourth leading cause of death globally. Fortunately, some negotiations resulted in lower prices for AIDS drugs for low-income countries. U.S. President George W. Bush created PEPFAR, a $15 billion plan over 5 years. And in 2015, international organizations supported Sustainable Development Goals, including a specific goal to end the AIDS epidemic by 2030. So from cholera to COVID-19, from past to present, what have we learned? The widespread perception that infectious diseases were conquered was just simply wrong, and the public health system must be continually prepared. Cholera in African refugee camps, diphtheria in the former Soviet Union, tuberculosis in the United States were all attributed to breakdown in our public health measures. And many new infectious diseases emerged during that time. There were 3 pandemics in the 1900s from new influenza A viruses. Animal reservoirs or zoonotic disease became an increasingly important source of infections in humans. Authors agreed that we are not prepared. And as we know now, public health officials, scientists, and healthcare professionals continue a worldwide struggle against our current COVID-19 pandemic. Let's talk about vaccines. Smallpox was called the speckled monster. In the 16th century, it spread to the Caribbean, Central and South America, related to European colonization and the African slave trade. In the 1700s, 400,000 people died every year in Europe, and those who survived were left blind and disfigured. In London and Paris, smallpox became endemic, or it was a steady state, and the disease was seen at a lower rate. It never really went away. And in smaller locations, there were periodic epidemics still. The infection was spread through respiratory droplets or close contact between infectious virus material in the sores themselves. So the earliest smallpox prevention or inoculations were also called variolation. So how this worked was using a needle or sharp object. You took material from a smallpox sore from someone who was actively infectious and injected it under the skin of a healthy person. There were risks and benefits for doing this. The risk was that someone might actually get the disease and a lethal case of the disease, and in the process spread it to other people. But it was also possible to become mildly ill, get better, and gain immunity. So despite these risks, it was still widely viewed as preferable to the horrors of the disease. This practice was introduced to Europe from Turkey and promoted by royal families. It was also used in the New World in 1721 in Massachusetts. So how do we get to vaccination? This is another well-known story in public health. A physician named Edward Jenner noticed that people who recovered from cowpox did not get smallpox. And in 1796, Sarah Nelms, a milkmaid at a farm that was close to his medical practice, developed cowpox. So he used the material from one of the pustules on her hand and inoculated James Phipps, an 8-year-old boy. He became mildly ill but recovered fully. On July 1, he inoculated the same young boy with smallpox, and he remained healthy. And when he did this again, the boy stayed healthy. So here is an artist's rendition of Dr. Jenner performing his first vaccination on the left, and here is his scientific publication, courtesy of the National Library of Medicine, on the right. So vaccine controversies were widespread. Some people were had enthusiasm, and some were in great disagreement, and particularly the medical establishment, who actually profited from part of their practice from variolation. Religious leaders objected, and sometimes the public. Political cartoons captured some of this around cowpox, and I'll show you that. Later, variolation was made illegal in England and Wales by an act of parliament, and whereas vaccination was free and available to the public. So this policy practice made vaccination much more widely acceptable. And here's a cartoon of the cowpox, or the wonderful effects of the new inoculation. And this is from the Anti-Vaccine Society. And in the center, you can see someone getting the inoculation, and you can see the other people have gotten inoculation, and some have cows growing out of their eyes and ears and nose and mouth, and sometimes their entire head. Another vaccine example, and this was a famous public demonstration. In 1878, Louis Pasteur read his paper, The Germ Theory, and its application to medicine and surgery. At that time, scientists read their papers out loud to a group of people. So in this case, it was the French Academy of Sciences. And he wrote that anthrax was a bacterial disease. Anthrax killed millions of livestock every year in France and had a huge negative impact on the country. So Louis Pasteur was invited by the president of the Agricultural Society to conduct a public experiment on a farm in the small town of Puy-le-Fort. They gave him lots of animals, 60 sheep, 10 were untreated, 25 were vaccinated, 25 were unvaccinated, and 10 cows. So on May 5th, 1881, 24 sheep and 1 must have wandered off, 1 goat and 6 cows were injected with 5 drops of attenuated or weakened anthrax. A booster was given to these animals 2 weeks later. And then after 2 weeks, all of the animals were injected with a very virulent strain of anthrax. Imagine the scene outside on the farm. There were several hundred local people, agricultural officials, farmers, Times reporter, veterinarians, members of the French Academy of Sciences, and the public. Everyone watched all this, and particularly when all animals were injected with the virulent anthrax, and then they went home and came back 2 days later. What happened? This is a picture of this public demonstration. So the 24 sheep, the goat, and the 6 cows which had received the vaccinations of attenuated or weakened anthrax all remained healthy. The rest of the animals had died, and some died right in front of everyone's eyes. Louis Pasteur was also interested in creating a vaccine against rabies. Rabies was called canine madness or hydrophobia. It was always fatal. On July 4th in 1885, a small boy, Joseph Meister from Alsace, France, was viciously attacked and bitten by a feared rabid dog. His mother had heard about Louis Pasteur's experiments with vaccines in animals and pleaded with him to do something to help her child. So using his vaccine that he had developed from rabbit spinal marrow, and he had already used that in 50 dogs. Remember, Louis Pasteur was a chemist, not a physician. So he did this in the presence of 2 medical colleagues. He began a series of injections from weaker to more virulent ones and gave a total of 13 injections in 10 days to the young boy. Joseph did not develop rabies and recovered fully. And here's a picture of this, courtesy of the National Library of Medicine. So vaccines, from past to present. What have we learned? The progress was sometimes dramatic in these stories, and vaccines remain urgent global health needs, both in the development and particularly right now in equitable access. Vaccine controversies are not new. Anti-vaccine sentiment was widespread in the earliest development of vaccines. And in 2020, as we had the COVID-19 pandemic, as there was the race to develop a vaccine to prevent the infection, there were initially technical hurdles, and there was politics, and we know there was some public uncertainty, and vaccine controversy remains today. Global equitable access to vaccines remains a goal of international partnerships, and in part, this is in response to the health inequities that were uncovered as we experienced the COVID-19 pandemic, both in the United States and across the world. Let's move on to our third topic, Silent Spring and the Environmental Awakening. DDT was born in 1939. It was discovered to kill insects. It was used to protect against malaria, typhus, and other human diseases in the military and the general public. It was sprayed out of airplanes, and the concerns began in the 1940s. The chemical properties of DDT were such that it could accumulate in the fatty tissues of humans. It could be concentrated in the food chain, milk, butter, and also mother's milk passing to young babies. Some of the pests that were designed to be killed by DDT, such as mosquitoes, became resistant, and this was worrisome because of the human diseases, for example, encephalitis and also malaria and yellow fever related to mosquitoes. The residues were soon everywhere, and there became the concern of potential cancer risks, which would take years to reveal themselves. So here's a picture of a crop dusting biplane from the 1940s. So our oversight from the government had a lot of gaps, and in fact, the pesticide use was promoted by the U.S. Department of Agriculture. A woman named Rachel Carson wrote a book called Silent Spring, and this was published in 1962, at first by the New Yorker. It triggered national news. It was intensely popular, and also triggered an immediate reaction from the industry. President Kennedy set up a federal committee to study it in 1962, and in 1963, Rachel Carson testified to a U.S. Senate subcommittee. I included this quote because it still resonates with me today. She said, "Our heedless and destructive acts enter into the vast cycles of the earth and in time return to bring hazard to ourselves." The government acted. The EPA was created in 1970, and DDT's sale was banned in 1972. It's classified as a probable human carcinogen. Since 1996, EPA has been involved in international agreements to regulate DDT and other pesticides as well, and the Stockholm Convention on Persistent Organic Pollutants, which includes DDT, includes limited exemption for DDT's use to prevent malaria worldwide. From pesticides to pollutants and smog. Donora, Pennsylvania was a small town near Pittsburgh on the Monongahela River, deep in a valley with steep cliffs rising up on all sides of the town. It was home to the Donora Zinc Works, which was a part of U.S. Steel. In the end of October in 1948, calm weather created conditions for a temperature inversion. Ordinarily, cool air is higher up. In a temperature inversion, you have cool air close to the ground and warmer air above that, and that warmer air creates a lid for industrial plant emissions, riverboat exhaust, train exhaust, and home coal smoke, which actually were trapped in a layer of dense smog from October 27th to 30th. 20 people died before there was some heavier wind and the fog lifted. Nearly half of the town's residents became ill. 400 were admitted to the hospital. Makeshift hospitals were created in the town to accommodate all the people who were ill. An investigation was conducted by a group that included representatives from the industry, the state health department, the local borough council, and the U.S. Public Health Service. As they completed their investigation, they suggested the factories dramatically reduce sulfur dioxide and particulate matter emissions, and also issue regular weather alerts if there were similar weather conditions. This particular investigation was unique and published by the U.S. Public Health Service and contributed to the 1955 U.S. Air Pollution Control Act, and this provided funds for public health research on air pollution. It was a unique investigation in that it focused on an environmental topic and predated the environmental investigation to discover the cause of the association that caused Legionnaire's disease. Now here's a couple pictures of this. And the picture on the right shows shortly after the smog episode of 1948. And if you look in the distance, you can just see the dense, smoky-looking air that was still hanging over the town. Similar things were happening in London. From December 5 through 9 in 1952, there was a sulfurous smoking fog in the city, and this lasted almost a week until it got windy and it passed. It was called the Big Smoke. Wasn't necessarily easily notable to doctors and hospitals, but the undertakers and florists knew there was a problem because there were no more caskets and they ran out of flowers. So there was subsequently a rise in pneumonia, hospital admissions, and deaths. And looking at this time period compared to a year prior, it showed that there were more than twice the number of deaths, and also hospital admissions were more than double for the same time, since the same time a year prior. Finally, Clean Air Acts were passed in Great Britain in 1956 and 1968 that regulated smoke emissions and required changes to alternative fuels. And here's a picture of London's double-decker buses in the foggy streets in 1952. Other things that were happening, if you read the newspaper accounts, there were soccer matches you had to be canceled, you couldn't see in front of you. There were lots of motor vehicle accidents, and there was also looting because no one can see the thieves breaking into the storefronts in the city. And then the river caught fire. In 1969, the Cleveland Plain Dealer had a short news story that was buried inside the paper that said oil slick fire damages 2 river spans. And this is a fire on the Cuyahoga River, which was the winding or crooked river. This river had caught fire 13 times since 1968, including a massive fire in 1952. And surprisingly, rivers and cities, Baltimore, Philadelphia, and Detroit had also caught fire. What was going on was that along with industrial growth, there was dumping into the rivers and they became polluted. And this happened at a time of industrial progress and economic gain. And at the time, there was little thought about what might be happening to the quality of the river water in the long term. But all of these things, these events in terms of pesticides, air, and now water, work together, and public attitudes towards environmental pollution were shifting. Congress passed its first federal Water Pollution Control Act in 1948, and in 1972, amendments added and strengthened many of those protections that were already in place. And here's a picture of the Cuyahoga River burning in 1952. So what have we learned from the environmental awakening in the 70s, from past to present? I think the biggest impact is we have to think about climate change and human health, and the severe weather and extreme heat and air pollution and allergens and changes in vector ecology and new infections and impacts on water quality and the food supply. I think what's important to remember is that all of the environmental events of the 50s and 60s and finally through the 70s really worked together and created huge policy acts of Congress to try and impact and improve the environment. And those are some of the important lessons for the current time. Let's move on to healthcare, health activism, healthcare evolution, Obamacare, and beyond. The origins of health insurance began in 1883 from Otto von Bismarck in Germany, and that was introduction of compulsory health insurance. And Winston Churchill and Lloyd George soon followed in the United Kingdom in the early 1900s. After the Second World War, the countries created ways to buy provider services, and they used national health models, or generically called social security systems. In 1973, the United Kingdom reorganized the National Health Service and valuing primary care and community health care in lieu of more expensive hospital services. And the first global policy for primary care was in the Declaration of Alma Ata in the USSR in 1978. In the United States, our healthcare evolution began in the early 1900s, where models of health insurance gave momentum promoted by the American Association for Labor legislation. But this progress was halted as we entered the First World War. Around that time, there was also a very important report to improve the quality of medical education in the U.S. called the Flexner Report. And what this did was it improved the quality of medical education. It also resulted in closing of many medical schools in the United States and had an unequal effect on Black medical schools, which declined from 10 to 2, which dramatically reduced the Black physician workforce in our country. In 1935, the Social Security Act was passed in the United States but did not include health insurance. Our healthcare history paralleled and was intertwined with our history of civil rights and broader social initiatives, along with policy and community activism. Hospitals grew, and they became our physical locations for healthcare delivery. Health coverage became part of labor management contracts, which still remains today as our connection to employment and healthcare. Many presidents tried, without success, to expand healthcare to all U.S. citizens. As an example, Harry Truman tried to create a national health system, but that was crushed by the American Medical Association. This is a picture from a wonderful exhibit in the U.S. National Library of Medicine called For All the People, a Century of Citizen Action Healthcare Reform. And this is called Protected, and this is from the American Labor Legislation Review in 1919. And you see the people protected under the umbrella, and that umbrella of health insurance from the rain. And the rain is sickness, and the dark cloud above that is destitution. Medicare and Medicaid. One author described U.S. hospitals and health professionals in the 1960s as the envy of the world. Also in the 1960s, the advocacy was stronger and more widespread to finally create a system that insured more people in the United States. In 1965, Congress passed Medicare and Medicaid to provide health insurance for older Americans and people with limited income. It also required hospitals to comply with racial desegregation. Although President John F. Kennedy had supported this, after his assassination, President Lyndon Johnson became very much the advocate for Medicare and signed that bill in 1965 in Missouri with former President Harry Truman. And here's a picture of this. So Medicare was 1965. In 1962, the National Association for the Advancement of Colored People, NAACP, filed a lawsuit against the separate but equal medical facilities on behalf of Black health professionals and patients. The Black Panther Party was founded in 1966 in California, and their advocacy for healthcare access was central to medical civil rights. They created free health clinics in poor urban neighborhoods, such as in Chicago. They used volunteers, doctors, nurses, students to provide health care. They also used community health workers, and their model linked family to health and social services, including free breakfast programs for children. The People's Free Medical Clinics were in 13 U.S. cities, and they advocated throughout this time for free healthcare, especially preventive healthcare, access to more research, addressing social needs, and promoting health literacy. So here's a picture of the Black Panthers Free Health Clinic in 1972. And here's a Breakfast for Children's program, also sponsored by the Black Panther Party. So policy remedies. Although the separate but equal principle was outlawed in Brown versus the Board of Education in 1954, there were Jim Crow laws, and that continued the segregation history. The 1964 Hill-Burton Act financed hospital construction, but allowed segregated facilities if there were similar facilities for Blacks. And Alabama, for example, had segregated hospitals in virtually the entire state. Title VI of the 1964 Civil Rights Act prohibited discrimination based on race, color, and national origin and outlawed this practice at hospitals receiving federal funding. Medicare in 1966 provided additional incentives for non-discrimination consistent with the Civil Rights Act. A much later analysis of infant mortality rates before and after the Civil Rights Act showed that eliminating those Jim Crow laws resulted in a reduction in Black infant mortality rates. So healthcare costs continued to rise. It was fueled by hospitals and a reliance on hospitals as the location for healthcare, specialty care, and increasing growth of use of technology. President Nixon tried to forward a comprehensive health insurance plan that failed. There were efforts that tried to address some of our vulnerabilities, even though there was not an overall plan. For example, a community health center program was created to serve underserved patients and emphasize primary care in the 70s. This is now known as federally qualified health centers. I mentioned the 1978 International Conference on Primary Care in Alma-Ata, USSR. And that resulted in the Declaration of Alma-Ata, signed by 134 countries and 67 international organizations. This declaration affirmed that health is a fundamental human right, and it also included attention to social factors and social justice. Healthcare costs continued the dramatic increase, and in 1990, about 37 million individuals in the United States lacked insurance coverage. President Clinton took up the charge and in 1992 delivered his address to Congress on health care, calling for action. Unfortunately, the proposal was very complicated. It was described in the New York Times as the most complex, detailed legislative blueprint devised by any president. Unfortunately, it was so complicated, the public could not decide whether or not they supported it. The Health Insurance Association of America decided to develop commercials, and they were widely featured. And they included a fictional couple named Harry and Louise, and they were sitting at their kitchen table. And they were talking about the government, the federal government's role and control of healthcare. These were very effective. And the Clinton bill died exactly a year after the president's speech to Congress. And this is a picture of Harry and Louise healthcare ads. And this is from the Clinton Presidential Library. In 2009, President Obama spoke to a joint session of Congress and said, "I am not the first president to take up this cause, but I am determined to be the last." Harry and Louise, they were against the Clinton health plan. They came back, and this time they supported the Affordable Care Act. So the Patient Protection Affordable Care Act, known as the ACA or Obamacare, passed and was signed into law on March 23, 2010. In 5 years, there was a 43% decrease in the percentage of uninsured people in the United States. So what have we learned from past to present? Today, in international comparisons, the U.S. still spends more on healthcare but trails in measures of health and longevity. There remain tensions between healthcare costs, access, and quality. And these are made worse by social health determinants and barriers to health equity in our country. In 2015, the World Health Organization and World Bank Group reported at least 400 million people across the globe lack access to essential health services. And in 2020, many studies of COVID-19 revealed huge inequities in access to healthcare and also in disease incidence, chronic conditions, inequality, and social factors, and concluded that the evidence to date reaffirms that structural racism is a critical driving force behind these COVID-19 disparities. Lack of health care remains a global threat to health. So in summary, stories from public health history show us some of the nuances of science, culture, social, and political contexts. If you look at public health history and some of the issues that are so important today, they give you a sense of context and a longer perspective. Progress in practice, in public health practice, sometimes predated discoveries. If you think about how John Snow conducted his work, or Louis Pasteur discovered vaccines, or even the discoveries about Legionnaire's disease, often before we knew the exact cause, progress was still made. Discoveries in science and public health practice required bold courage, challenging conventional thinking, and this happened time after time. Some of the things that we didn't have an opportunity to talk about today, but Edwin Chadwick, who wrote the Sanitary report, and was a champion for the Great Sanitary Awakening in 1842, linking health and social factors to health improvements, really found great opposition to his thinking. And that was true in many, many examples in public health history. We can think later to our barriers to remedying social inequities and social determinants of health from W.E.B. Du Bois's work to show greater mortality in New Orleans and then New York among Black Americans, and the landmark research in the 1960s on differences in the Whitehall study among British workers. All of these things have met with resistance in terms of putting that research into practice. History provides perspective and context to our present-day challenges, and some of these examples I think are really relevant to today's public health issues and giving us hints to a path forward. History provides us an optimism. If you look at that longer-term perspective, even though there were challenges and many of these issues took years to get better, there was still a path found forward with that perseverance and many sometimes champions of public health, but that patience and persistence to continue to move forward. Today, in an environment where public health has never been more important, I think that history gives us optimism, and I'm going to end with that.
Wonderful. Thanks, Jan. And now the floor is opened up for questions. I do have one here. I enjoyed the old cartoons, photos, and images from other times that you included in today's presentation. It's obvious that you did a lot of research on old periodicals and publications. Have you included visuals like these in your new text?
Oh, yes, absolutely. There's lots of them. I think they're really important. The work of artists of the time and sometimes political cartoons were really important in giving you a sense of what was really going on at that time.
Wonderful. If you could prioritize one public health issue, what would it be?
That's a tough one. I gave you an example of some of the categories. I think that one of the big topics that's so relevant today in the pandemic is preparedness and how we were never prepared. And I think that when COVID-19 hit, we were not prepared. And what happens was we've had a history of crisis and panic, and then when things got better, neglect. And if there's one lesson I think that we need to remember is that we need public health, and we need public health today more than ever. And we have to remember that public health is essential for us to be prepared even when times get better.
I have another question for you. What initially interested you in digging into the history of public health?
Oh my goodness. I think that I became intrigued when I learned about some of these past stories and some of my current work in public health practice and research. And I got curious and went, maybe I'll look at a little bit of that, and a little bit became a little more research, and then ended up to a book.
Another one for you, Jan. Do you think that health literacy would be one of our strongest protective factors for addressing these crises?
I think that the more that we are able to communicate with people and have them understand the science of public health and why it's important, and for people to become partners in their own healthcare and the health of their community, that supports everything that we do in the science of public health.
I appreciate the optimism you mentioned, but considering how we know so much more about transmission, et cetera, why do you think there is such continued resistance to masks and vaccines?
I think that, I guess one of my messages is what we're seeing today has been seen throughout history. And you have to not give up. We have to persevere. We have to use the science. We have to develop more research where we need it and educate the public. And as we educate the public, the policymakers will come around eventually, and we can't give up. And that's been one of the important lessons through history. That's how we keep moving forward.
Another question, what will it take for the CDC to regain their credibility?
They need to keep doing their job as they're doing their best to do. And there's been a ton of controversy, and that is the world of public health. But the more they continue to conduct their science and report on the science to the public, they remain our largest public health agency in the U.S.
Okay, I know we're at 2 o'clock, and the final parting comment here is thank you to Dr. Kirk Carney for providing this exclamation point. So I believe that's all we have time for today. If there are additional questions, we will try to respond to them in a follow-up email. In closing, I want to thank Jan Carney for an extremely interesting presentation. I know I certainly learned a lot. For any questions or comments, please email me, Suzanne Walker, at swalker@jblearning.com. And for more information about Jan's text, you can go to go.jblearning.com/Carney-history, and you will get more information, and you can request a review copy if interested. Finally, I want to thank all of you for joining us today. I hope you enjoyed the presentation and can take another minute to provide us your feedback in the brief survey following today's webinar. I wish you all a great rest of your day. This ends today's webinar. Thank you.